I think it's important when we think about these targeted therapies, because so many of us have experience managing chemotherapy toxicity that we think maybe, oh, these are a little bit less dangerous in some settings, but I think it's really important the patient education component and as well as the nurse case managers, the advanced practice providers, all of those patients, and as well as the attending physician who take care of the patient as a team, need to know how to safely take care of patients on targeted agents, because it is really important to be upfront with the patient and your team about what's possible here so that we can make sure that we all safely take care of patients together.
Yeah, it really is such a team effort with these
Exactly.
drugs, because those patients will call with issues, and making sure your team has the right information to give them right off the bat while they're sort of touching base with you is so important.
Totally. And it can minimize, patients needing to come off of therapy early and aggressive symptom management on these.
Yeah.
There doesn't have to be high discontinuation rates, which I think, would be the easiest way just to say, stop the drug, go on to something else. But as we all know, these can also be really powerful drugs.
Yeah.
So when we talk about some of the data from the clinical trials as far as response, this can be another 6 months to a year plus of progression-free survival.
Yeah.
That's really important to patients as far as adding that time in their armamentarium of therapies to prolong patients' lives ultimately.
Yeah. Definitely. And educating our endocrinology partners too, because so many of these patients do end up seeing an endocrinologist because of the hyperglycemia, and making sure they're aware that these are not patients we want to reach for the insulin quickly because we don't want to mitigate the benefits of these agents, and making sure they're aware of which antihyperglycemics to really reach for in these patients is very important.
Can you speak to that a little bit more? I feel like that's a lost point that doesn't get talked about enough when we talk about this.
Yeah, so we know that starting insulin in patients who have hyperglycemia as a result of inhibiting the pathway can actually counteract the efficacy of the drugs. And so we don't want to reach for the insulin as our first line of defense. Metformin, SGLT2 inhibitors are really sort of the preferred agents. And so making sure our endocrinology partners are aware and know that this isn't a patient who's presenting with new onset diabetes, but rather drug-related diabetes, and that needs to be managed differently.
Yeah, I think that's super important. On a similar sort of note there, how do you feel about the use of GLP-1s in this setting?
Yeah, that's a big question, eh? We just don't know yet. I know that a lot of my patients, for sure, are already on GLP-1s or are interested in getting on GLP-1s. I don't have enough data about how it really changes the hyperglycemia, but it's something we really need to know. We need to understand better.
Yeah, I feel like that's a big question we're going to get more and more.
Yeah, for sure.
And there certainly are, ongoing clinical trials of how that may impact breast cancer.
Yeah.
In this way or that. We don't quite know the answers to that yet, but something to look out for in the future.
For sure. For sure.